one and all, respected Pro Vice Chancellor Dr. V.K. Kapoor sir, our esteemed panelists, the faculty members, especially from the Department of Medical Education, Dr. Aparna and team, and dear students. I welcome you all on behalf of the Department of Biochemistry to this very important and rather very interesting and informative panel discussion, what it means to be a doctor. As already sensitized you, informed you that this is part of your ADCOM module for the phase 1, where there are 5 modules, and this particular module, what it means to be a doctor, is being addressed by the Department of Biochemistry. And just to apprise our panelists and Pro VC sir and the faculty members, before this, initially when the students had joined, we had the hospital visit, of course, and we also had an exploratory session, and we have taken students' perspective upon what they feel it means to be a doctor. And today we have selected some of our senior faculty members for this important panel discussion. And also, I would just like to say that we have requested the students also only to moderate this session to make it more direct one-on-one interaction between the senior faculty members and the students. So, I would take this pleasure and privilege of introducing our panelists to all of you. First and foremost, we have one of the most senior oncologists, not only of the city or state, but of the country and of international repute, Dr. Hemant Malhotra sir with us. He is presently Director of Sri Ram Cancer Center and Professor and Head Department of Medical Oncology at Mahatma Gandhi Medical College and Hospital. And you can see, students, that he has all these accomplishments, these important posts and offices to his name. And we welcome you, sir. Please give a round of applause for Dr. The next panelist we have with us is Dr. Ashish Jain, a familiar face in Mahatma Gandhi. He is an experienced critical care consultant and director and professor from the Department of Critical Care Medicine. I'm sure sir must have taken some of the sessions for these students. So students must be familiar with you, sir, but he's an excellent clinician and he can guide you on several skills as a doctor. So we welcome Ashish sir. Next on the list is Dr. Priya Marva, Professor and Unit Head from the Department of Pediatrics and a bone marrow transplant physician. Madam is again an extraordinary personality. She is an author. She has published various books and also research paper. And do you know, students, that at this stage of her career, she is now pursuing her PhD. So, I'm sure she will be impressing you all with her words of wisdom. And then we have our another eminent faculty, Professor and Unit Head from the Department of Medicine, Dr. Anchin Kalia, an excellent clinician, and she is also taking care of the gender equity cell of our university and various other posts, and she has various publications and awards to her name. So we welcome you, ma'am. And of course, our last panelist is Dr. Balbir Singh. I take pride that he is the alumnus of our college, and now I also take pride in saying that he is consultant neurologist and epileptologist at our hospital and is the one first to establish the epilepsy monitoring unit and pursuing advanced epilepsy surgery and care in Jaipur. So a huge round of applause for Dr. Balbir Singh. So this welcome and introduction will be incomplete if we don't welcome our respected Pro Vice Chancellor Dr. V.K. Kapoor sir. Sir has interacted with you all on many occasions, but today he has shown his keen interest to be a part on this panel discussion. Sir, on behalf of the department and on the entire batch of MBBS 2024, we are really grateful to you for your gracious presence. So with this, we could start the panel discussion, and I hand over now the podium to the students, please.
Good afternoon, everyone. I, Akriti Agrawal, on behalf of all student MBBS Best 2024, I extend a warm welcome to all our respected faculty members, esteemed panelists, and dear students. It gave me great pleasure to introduce today's panel discussion under the ACOM module. Attitude, ethics, and communication, an integral part of medical education that shapes us not only as competent doctor but also as compassionate human beings. Our discussion will explore real-life scenarios, challenge stereotypes, and promote a patient-centered approach grounded in ethics. We are privileged to have with us an esteemed panel of experts who will share their experience, insight, and guidance on this vital aspect of our journey as future doctors. We are grateful to the Department of Biochemistry for giving us this opportunity to directly interact with some of the most eminent medical faculty members of our medical college. We seek blessing of all our respected teachers and looking forward to a valuable, informative, and fruitful discussion this afternoon.
Good afternoon to one and all present here. I am Manisha Goyal and I feel pledged to have this opportunity on behalf of my batch. So my question is for Dr. Ma'am. In a clinical practice, we often encounter challenges situations, especially in rural areas, where we had to manage patients with incomplete medical information, incooperative attitude, or families who hold strong stereotypes and myths about the disease. Such belief can significantly affect the diagnosis and treatment of the patient. In this context, how would you as a clinician approach such situation to ensure the accuracy of the diagnosis and effective treatment? And further, how can we as a medical student during our journey in medical college can incorporate our clinical skills?
Thank you so much, Beta. And a very good afternoon to all of you. Respectable Kapoor sir, Usha ma'am, Aparna ma'am, and all the colleagues present here, and dear students. I will take the question from the last question. I'll take first, that what about your journey as a medical student, and then I'll go to the case scenario. So when you come to a medical college, everybody has some kind of hopes and aspirations, your parents, yourself, your peers from you. So I think the new module or the ADCOM module is now focused very much on a very competent Indian medical graduate, and by that it means that so when you pass out from this college and you are seeing patients independently, then you should be able to reasonably see a patient independently or on your own, right? You will not, so like the case scenario, you will be working in a village or a rural area, or maybe in the emergency of your hospital, or maybe you are as an intern, you are there in the ward and you face some emergency. So the curriculum now is based on the fact that you should be able to handle a patient independently with proper ethics, challenges, reasoning, and using your own skills which you have learned over all these years. So when you come to ward now as a journey, so when you come to ward, be prepared of seeing a patient with empathy and with good clinical reasoning. For that you have to have knowledge and study first. So when you see a patient, if you do follow a stepwise procedure, I think most of us will never have a problem, or maybe you never face these challenges. The fights or the challenges which we face usually during our emergency ward practices, or the postings which are there in the rural areas, it is because of our lack of understanding or maybe the communication with the patient, right? So the communication at first is the most important thing. So whenever you see a patient, introduce yourself, ask the patient his name very respectfully, ask the patient attendants who are there, and take a history in a stepwise manner. So history taking is very important, and you will be able to take a good history only if you have some clinical knowledge. So over the years you need to have that clinical knowledge, and simultaneously you need to see these patients properly in the ward itself. Alright? So this is the number one and the basic step. is the history taking in a proper way. Next is applying your knowledge to it. Now once you have taken a history, you know that this system is there. Alright? The next question a patient would ask obviously would be, हमारे मरीज को क्या दिक्कत है अब? तो जब आपने you have taken a proper history, the next step is to apply that knowledge. Alright? So then you will have to explain to the attendants in a proper way in their own language that this is what is wrong with your patient or this system is involved. That includes your knowledge. The third step is to now give a diagnosis or maybe treatment. Obviously everybody has come for a treatment, आप सिर्फ diagnosis करके तो नहीं छोड़ देते हैं. So next is your therapeutic knowledge which now comes. So whatever you have read in the past few years, when you once you become an intern, would now be applied here. So in a proper way, you need to apply that knowledge by giving proper treatment. So history taking, making a diagnosis and then a proper treatment. These are the first three steps. Now comes the question or the case scenario, which is there that when you are posted in a village and somebody comes to you and then they are asking you कि हमारे patient को क्या हुआ है, and then they have their own beliefs. So definitely in India, you will always encounter patients who have their own beliefs. Like right now also, I just came after seeing a patient and she was a postpartum patient, 6 weeks, and she was wearing a shawl. And my first question was, are you having fever? Why are you wearing a shawl? And because of their own traditional beliefs, she said, नहीं, अभी मेरी delivery हुई है तो मुझे हवा लग जाएगी. This is the exact dialogue she said. So that's the personal belief, and that's okay. Because we live in a country, a society where you will be seeing such patients day in and day out. And this is a very small example. You cannot fight the cultural beliefs which are there. So you have to justify yourself. You need not to go against them or go in favor of them. But yes, you have to deal such patients with a holistic attitude. Now with holistic attitude, I mean that you apply your knowledge, your brains, your ethics, and then their cultural values also you have to keep in mind, and then you make a proper diagnosis and treatment. So when you follow a holistic attitude, this approach which is empathetic and holistic towards the patient, I think most of the patients would be, they will be aligned to you. They will not fight back or they will not discuss that. So always keep in mind right from the first year when you have been posted in the wards, abhi aap logon ki sabki posting lag jayegi from the next year. So make sure that when you come to the ward, you are very properly dressed. You have that attitude, that respect towards the patient, towards the colleague, towards the nursing staff who is there. Everybody is there to, help you. So take proper guidance from the seniors who are there. Take a proper history. Make sure that at least you are present in the ward to, you have to be upbeat yourself. We cannot force you. So when you do step by step of proper teaching, history taking, examination, treatment, and then maybe talking to them nicely in a sympathetic way, I think all these problems will be dealt with, and whatever the scenario was there about cultural beliefs and all, it will be taken care of. Thank you.
Good afternoon all. I am Aniket Vyas and my question is for Dr. Priya Marwa. Ma'am, as students we are told to build doctor-patient relationships, but the real life shows up with uninvited situations. Ma'am, in your field with such emotionally charged situations, how do you adjust your approach between patients of different cultures, languages and emotions? How do you manage their expectations? We would love to know from your experience.
Thank you, Aniket, and good afternoon, respected teachers, dear colleagues and dear students. Communication in the medical profession is basically two-pronged. Number one, how we deal with our peers, our healthcare workers, and number two, how we deal with our patients. So, addressing the question, Aniket, that you have put up, as a transplant physician, for me, addressing a situation which is life-altering and life-threatening at the same time, and addressing in a scenario where there is a lot of cultural, linguistic and educational diversity, it is quite challenging and a huge responsibility. Cultural diversity in our country, is something that we really need to address and when we deal with the patients. When you talk about a disease to the patients or families, some of the cultures believe that they want a direct, honest approach. कि आपके बच्चे को ये कैंसर है, ये some chances है ठीक होने के, ये chances है ठीक नहीं होने के. Others want it to be clothed in some positive optimism कि हाँ हम लोग कोशिश तो कर रहे हैं, chances हैं ठीक हो जाएंगे. While another set would insist that, they want that the whole family should be addressed. And when we talk about family, it just doesn't mean if it's the patient is a kid, they want, uncles and aunts, और वो गोत्र से रिश्तेदारी है, ये दादाजी के भाई से लगता है. So you need to address. You cannot start off कि नहीं सिर्फ मम्मी पापा अंदर आएंगे. So these are some things we really need to address when we talk to the patients' families or the patients themselves. When it comes to discussing with the family, it is very important. For me, it is a very easy part because I'm a pediatrician. I don't have to take the consent of the child. But as physicians and adult clinicians, you really need to ask the patients, are you comfortable if we call in the other members of the family? If the patient says no, then you need to address it differently. You can't insist that parivar ko saath lana hai or I'm going to talk to you one-on-one. So these are some things you really need to address timely. Then it comes to linguistic diversity. It's not very easy always to address the patients in their language. So the best thing is, if you have what we call as a medical interpreter, never ever rely on the family members to translate what you have told to the patient. You really do not know, because number one, the reason I'm asking someone else to translate is because I'm not very well versed with the language that the patient is speaking. So I really do not know if I have said something and the uncle is going to translate the exact same thing. So always, ensure that we have a medical interpreter who can translate whatever you have said, whatever medical terms you have said in the dialect of the patient that he or she uses. Then, of course, when it comes to cultural beliefs, you have to respect. Some people will insist that our culture में इस तरह से चीज़ होती है. You cannot start shouting or screaming at the patients कि इलाज कराना है तो भी हमारे हिसाब से कराओ. Some patients, might come up with the moment you say that this is the diagnosis, they might come up with कि we would like to take a second opinion. And this is where, that part of the communication comes into fore, where you have to learn to respect your peer groups. Whether your seniors, your juniors, or your peer professionals, you have to be, put up a picture where the patient feels that you have a good clinical acumen, but then you are also respectful towards the other doctors. You just cannot shout out at a patient, saying कि मैं सबसे senior हूँ, मेरे से ज़्यादा उसको क्या आता होगा. And to be honest, I always tell my PG students that when it comes to recent advances, I think they are more well versed than probably what I am, because they are reading the latest editions. Ask me as a pediatrician, probably I will not be going through my latest edition of Nelson right from letter 1 to the last page. But these PG students would be going through it, so they are very well versed with it. And this is how we have to respect your healthcare workers, respect the nurses, and respect even the housekeeping staff. You cannot, I always love the example of that movie, I think Munna Bhai MBBS, it was where I think Sanjay Dutt tells, see how a person treats his or her juniors actually portrays a person's character and integrity. So you cannot say clap your fingers or your hands to call a person, even if he or she is just maybe the ward lady in your department. So give due respect. And then, of course, I think a very major challenge that all of us clinicians face is when it comes to a terminal illness. Then patients usually will ask you directly, Doctor Sahab, kya main bachunga kya? Now this is a very difficult question to handle. Probably in your heart you know that the patient may not survive, but then you just cannot walk up to the patient and say, सुनो तुम्हारे को ये हो रहा है, तुम बच नहीं सकते. Or you cannot even say कि नहीं कैंसर तो 4th स्टेज का है, मेटास्टेसिस हो चुका है, पर पूरे 100% चांसेस है कि आप बच जाओगे. So what you've got to do is you address the situation as and when it requires. Number one, you have to tell the patient that this is the situation. You and I and our team is going to walk through all the challenges, all the treatment modalities together. Probably every day we will reassess. Probably every day will bring a new challenge, and probably every day may be, disheartening to you also. But remember, our team, the medical team is with you, your family is with you, and every hurdle, we would try to overcome as a team, and we'll walk through whatever lies ahead together. This thing, actually creates not what I would say as a false hope, but a trust in the clinician, in the eyes of the patient. And this is where, your character and your integrity comes out very strongly as a good communicator with the patients and with your team. Thank you.
Good afternoon to all. Myself Arpit Swalka, MBBS batch 24-25, and my question is for Dr. Hemant Malhotra. So sir, as a distinguished leader of this institution, you have many doctors, postgraduates, undergraduates, paramedical and members of different allied groups. So sir, how do you manage to make them work in a harmony, and what were the efforts made by you to attain such a leadership quality?
Thank you, Ankit. So I will take about 2 or 3 hours to answer this. So please be patient. I don't know whether I am a distinguished leader or not, or whether I like it or not. I am a leader. I take care of the oncology in this institution. Distinguished or not is a question mark in my mind also. सबसे पहले तो ये बताओ, how is the Josh? अभी आधे घंटे तो सो रहे हैं. How is the Josh? ये बात है ना. अच्छा मुझे एक दूसरी बात बताओ. Before I answer your question, I want to ask you a question. अगर ये कोर्स, ये पैनल डिस्कशन आज की अटेंडेंस कंपल्सरी नहीं होती, तो कितने जने आते हैं? मेरे को ऑनेस्टली हाथ ऊपर करके बताओ. ये तो मतलब बायस्ड ग्रुप है. So I think the whole purpose of this exercise is to kind of give a glimpse of where you are heading. 1 out of 20 of you will get to a leadership role, maybe in a corporate hospital, maybe in academic center, professor and head director will come one way. And of course, each one of you would want to reach the top and get to that leadership position. Now, what are the qualities of a leader and what are the things which you should start thinking of right now if you want to get to that level? See, I've been in this field for 40 years. I entered medical school in 1975, and as I said, other than Dr. Kapoor, I think most of the people on the panel are my students, and you guys were not even born at that time. So it is very possible that things might have changed and there might be different ways to get to leadership now. Maybe Balveen can tell you what today's leaders need to do. But what I think you need to do is, number one, have patience. अभी जो young crop में है वो उनको लगता है कि हमने MD कर ली, we are in the top of the world, and I want name, fame, money, leadership tomorrow. That doesn't happen. It takes years and decades of effort and a whole lot of luck to get to be a leader. So patience is important. Don't be in a hurry. You can get there, you will get there, but the path is slow. If any of you is married or your sisters are married and they are expecting a child, parishani hoti hai pregnancy mein, big tummy, you say that I want the baby in 3 months. It doesn't happen like that. जो time लगता है gestation का, वो time लगता है. So inculcate that habit and practice of patience. Patient नहीं, जो अपना अपन देखते हैं, जो अपनी जीविका है, patience. थोड़ी शांति, थोड़ा संयम, हाँ, थोड़ा धैर्य, yes, correct. Then I think honesty might be an old-fashioned trait, but to be a good leader, for somebody to want to be like you, to be an idol, to be an ideal, unless you are honest, that will not happen. Nobody will want to be like Justice Verma, right? Anybody wants to be like Justice Verma, the Supreme Court judge? So that again is a habit which you can inculcate now. If you are honest with yourself, if you are honest with your colleagues, if you are honest with your patients, then that is the first step towards successful leadership. One more important aspect, if you are honest, then you don't have to remember कि अंचिल को मैंने क्या बोला था, बलवीन को मैंने क्या बोला था, जो सच है वो बोला था, so you don't have to remember that. And sometimes जो मैंने बलवीन को बोला था, वो मैं अंचिल को बोल देता हूँ, और अंचिल से सर आपने 3 दिन पहले तो कुछ और बोला था. So if you are honest, then you don't have to remember. There is one default setting which works for everybody. So old-fashioned or not, that is a trait which will help you. And you have to be fair. You have to be fair to your colleagues, you have to be fair to your juniors, you have to be fair to your seniors. Once you climb up the academic ladder or the corporate ladder or the success ladder, you tend to have favorites. You tend to have a caucus. But in case there is a conflict, in case there is a fight, then you have to be fair. Even if somebody very close to me is there involved in that argument and that person is not correct, then you have to have the courage to say, you are not right, you are wrong, that person is correct. So you have to be fair. And a related trait is that you have to listen to everybody. There is a fight between Dr. Ashish and Dr. Priya. And Ashish is my student, he's been with me for 20 years. I just listen to Ashish and pronounce a judgment. That is not right. I have to listen to Dr. Priya also. I have to give her a fair chance to present her side of the story before I make a decision. Simple thing, but many times not done, and many times that is the reason why you cannot be a good leader. Then you have to learn by example. You will always, in your MBBS career, in your MD career, in your super specialty career, if you choose to do super specialty, you will like one person, one senior, maybe a senior resident, maybe a faculty member. I want to be like this person. That person may have 7 good points and 3 not so good points. So you have to remember to learn those 7 good points, imbibe those 7 good points, not imbibe those 3 not so good points. My mentor, when I was doing medicine, I will not name the person, had in addition to a happy family and a wife, he had a mistress. Now I used to tell my wife, कि देख Bharti is my wife, if you want me to be as successful as my mentor, then you have to permit me this. I don't want success. You better not do that. So, jokes apart, your mentor, your ideal will always have some negative points. So, be sure that you don't imbibe those points, recognize those not so good points, but focus on the good points. Then you have to lead by example. If you are a leader, you are under the spotlight, microscope, whatever you call it, your every single action is being very closely observed. You cannot afford to not do the right thing all the time. So you have to lead by example. If you as a leader, say for example a unit head or a PHOD start yelling and screaming at your residents in the middle of the round, or start yelling and screaming at your nurses in the middle of the round, then your leadership caliber immediately drops. So you have to be careful even in the personal life, even in the professional life, that you lead by example. It's not an easy job, but it's tough. And one very important thing, last thing which I want to tell you is that be ready to help everybody at every time. It's a small world, it's a round world, everything comes back. The person who you are being nasty to or the person who you are being unfair to, the roles might be reversed tomorrow, the roles might be reversed sooner than you think. I may be there and you may be here. So, as far as possible, कितना भी जूनियर हो, कितना भी सीनियर हो, अगर आप हेल्प कर सकते हो उस इंडिविजुअल को, तो थोड़ा सा एफर्ट करके हेल्प करो. अपने फ्रेंड्स, कॉलीग्स को तो most certainly help करो, unless there is very glaring evidence that this person is really bad and he or she's done really bad, try and shield your professional colleagues. I've been on tens of committees when I was like senior faculty at SMS. So I've really truly tried my very level best to help as many people as I could. And that has come back to me. What I was just telling you, everything is around. The roles are very quickly reversed. एक जने को आपकी जरूरत है आज, पक्की तौर पे आपको उसकी जरूरत होगी कल. So your default setting is कि अगर मैं इसकी मदद कर सकता हूँ, तो मुझे इसकी मदद करनी है. Okay? You are in a great profession, and my very best of luck to you.
Good afternoon, everyone. Myself Abhishek Budbar. My question is on professionalism for Dr. Ashish Jansa. In the face of common ethical dilemmas in medical practice, how can doctors uphold professional integrity while also maintaining their personal well-being and work-life balance?
Thank you. Very good afternoon, everyone. Good afternoon, senior faculty members on the dais, off the dais, and my dear students. So first of all, I would like to start congratulating you. You have started a journey towards being a doctor. But being a professional needs something else. You need to be knowledgeable. You need to have integrity. You need to have accountability. You need to know the ethics. You need to know the professionalism. Then only you will be called as professional. How many professions you know जिनको हम बोलते हैं कि ये प्रोफेशनल है? Apart from doctors, they are engineers, architects, teachers, lawyers. So, answering this question, I will take 3 examples. The first is, I am a physician and a patient's attendant came to me for a second opinion. और वो जिनको दिखा रहे थे, प्राइमरी फिजिशियन जो है पेशेंट के, ही इज वन ऑफ माई बेस्ट फ्रेंड. बहुत अच्छा. मेरे पास सेकेंड ओपिनियन के लिए जैसा हम लोगों के पास आते हैं डेली. आई एम श्योर एवरी वन ऑफ अस हैव. ही पेड यू, आपने उनसे प्रोफेशनल फीस लिया, ठीक है. आने के बाद उनके 2 क्वेश्चन है. सर, हमारा ये ट्रीटमेंट चल रहा है इन डॉक्टर साहब के पास में, एक तो ये बता दीजिए कि सही है क्या, और दूसरा ये बता दीजिए कुछ और करना है क्या, हमारा मरीज ठीक नहीं हो रहा. वेरी कॉमन क्वेश्चन, वेरी कॉमन सिचुएशन. You look at that prescription and you find out there is something missing. Something missing. हो जाता है कई बार, कुछ चीजें नहीं क्लिक करती हैं, कुछ चीजें रह जाती हैं, कुछ सेकंड फेलो का कोई माइंडसेट होगा, इसने नहीं शुरू किया. What will you do? Are you going to tell the attendant, अरे यार उसको तो कुछ नहीं आता, उसने तो कुछ भी नहीं लिखा, ये बहुत इंपॉर्टेंट थी दवाई, ये मिस कर दी, इसीलिए तुम ठीक नहीं हो. Are you going to tell it? बोलने वाले हो, कैसे हैंडल करोगे? What is the way out? And to find out the deficiency, you need to have knowledge. The first thing for a professional is having a good knowledge of your subject, number 1. And number 2, you should have ethics towards your colleague as well as you have to have ethics and responsibility toward the patient as well. He has paid you, तो क्या करना है? You can easily say कि ये बहुत अच्छे डॉक्टर है, मेरे बहुत अच्छे मित्र हैं, आपका इलाज बहुत अच्छे से हो रहा है, आप बहुत ही सेफ हैंड में. Believe me, 99% ऑफ टाइम अटेंडेंट यही सुनना चाहते हैं कि हम जिससे इलाज ले रहे हैं वो अच्छा डॉक्टर है. उसके बाद आप उन्हें कहें, आई एम राइटिंग सम ऑफ द थिंग्स, आप उन डॉक्टर साहब को दिखा देना, अगर उन्हें ठीक लगेगा तो वो चालू करें. सो गिव योर ओपिनियन without hurting the sentiment of the attendant as well as without hurting your colleague, your professional things with your colleague. That's how you need to behave in your day-to-day life. Second example, which was asked by one of the students, it is about क्यों attacks होते हैं. Ma'am has given you the beautiful answer. It is because we forget to follow our professional ethics as well as the communication. Most of the time, 99% जब आप रूटली किसी से बात करते हो, आप पेशेंट के अटेंडेंट्स की या पेशेंट की सुनते नहीं हो, you are not giving them proper timing, you are not showing the empathy, then these things happen. ICU में हमें रोज कम से कम 5 से 6 बार ऐसे पेशेंट्स, ऐसे अटेंडेंट्स आते हैं जो कि परेशान होते हैं बिकॉज ऑफ द पेशेंट, द फैमिली मेम्बर इज वेरी सिक, ही इज डाइंग, ट्रीटमेंट उन्हें समझ नहीं आ रहा, इतना सारा फाइनेंशियल बर्डन आ जाता है, बहुत पैसे लगते हैं, वेरी मच इन स्ट्रेस, चिल्लाते हैं आके, वो बोलते हैं आपको, एंड व्हाट इज आवर ड्यूटी? टू लिसन देम कामली. फर्स्ट थिंग इज टू लिसन देम, देन स्टार्ट educating them, show them the empathy. Okay, मुझे पता है कि आपके साथ प्रॉब्लम है, आप बैठिए, थोड़ा पानी दीजिए उनको, सुनिए वो क्या कहना चाहते हैं. मैडम ने जो कहा ना कि धरवर की पूरी रामायण सुनिए, कोई प्रॉब्लम नहीं है, give them time, and then you start showing the your problem, you'll start building the things. आपके पेशेंट को ये प्रॉब्लम है, रिसेंट गाइडलाइंस के हिसाब से इतने % चांसेस हैं बचने के, हम अपनी तरफ से पूरी कोशिश करेंगे, हम आपका पूरा ध्यान रखेंगे, सिर्फ बातें कीजिए. That's how you can solve the problem. Otherwise, if you just rudely say ये तो नहीं बचेगा, समझ जाइए कि आपके ऊपर प्रॉब्लम आने वाली है. आपने एक को मना किया, वो 4 आएंगे, फिर आप और रूडली बोलोगे, वो आपसे और रूडली बोलेंगे, then someone will start abusing you or doing anything. Third thing, एक हम सब लोगों का, सारे डॉक्टर्स जो हम हैं, हम लोगों में भी बहुत लोग होते हैं, वो सोचते हैं कि यार मेरे पास कम से कम दिन के ना 100 मरीज तो आने चाहिए. मेरे सीनियर के पास इतने सारे पेशेंट, वो बहुत शी इज वन ऑफ देम. तो मेरे सीनियर कलीग हैं, मेरे एचओडी हैं, उनको तो वो तो रोज दिन में 200 पेशेंट देखते हैं. नाउ टेल मी वेरी ऑनेस्टली, you have 5 or 6 hours in a day to see patient. If suppose you are seeing 5 hours, 100 patient, that means 20 patient in an hour. That means 3 minutes to a patient. Are you doing justice to your patient? 3 मिनट में तो बात शुरू नहीं होती भाई. लिखना भी है, सुनना भी है, एग्जामिन भी करना है, बात भी करनी है, काउंसिल भी करना है, डाइट भी बतानी है, फिजियो भी बतानी है, ढेर सारी चीजें. Are you doing justice to your patient? So don't run towards these kind of goals. ऐसे में patient will, they are not satisfied with you. They will go to some other person who is more empathetic, who is more knowledgeable to you, and who is ready to give more time. And the last one, self well-being, the most important thing. आप सुबह 8 बजे शुरू करते हो, रात को 10 बजे तक काम करते हो. With growing age, your body needs some rest. You need to be more meditating yourself. You need some exercise. You need some yoga, some refreshment. Your family is growing. Your kids are growing. They need more time. अगर दिन भर पेशेंट ही देखने हैं तो उनको कौन देखेगा? और जब 60 साल की उम्र के बाद, सर प्लीज करेक्ट मी इफ आई एम रॉन्ग, जब आपकी उम्र 60 साल होगी, रिटायर हो गए, तब ना घर में बच्चे रहेंगे, ना उनकी छोटी छोटी चीजें आप देख पाएंगे, ना उनसे बात कर पाएंगे. दे विल बी बिजी इन देयर वर्क, यू विल बी लेफ्ट अलोन. सो हैव फ्रेंड, हैव हॉबीज, हैव टाइम टू योरसेल्फ. थैंक यू सो मच.
Good afternoon, everyone. I am Anushka Sharma, and my question is for Dr. Balveen Singh. In an ever-evolving healthcare landscape, it is imperative that the physician remains steadfast in the pursuit of continuous learning. Sir, what mindset shift is needed when transitioning from classroom knowledge to clinical practice? How can young doctors balance clinical duties and continuous learning on the job? We look forward to hearing your insight.
You have put me in a spot. 4 of the most esteemed people, and then I am answering. I think most of you guys don't even know who you are listening to and what kind of interaction this is. Because take it from me, I recently did my MBBS. I'm not some I'm not some old person like Hemant sir. I'm not some extremely talented professor like Ashish sir. So take it from me, these kind of interactions we never had during our MBBS days. And the question is very simply answered. The biggest shift when you go from textbooks to clinics is that patients don't read textbooks. So whatever you are going to be reading in the next 5 years, everything is going to be very structured, very patterned. That's not how patients are, and that's not how life is. So I think first step is you have to be humble. Be humble to your own knowledge. It's okay, you might be wrong sometimes. Medicine is not just science, medicine is a combination of art and science. So science you read from textbooks, art is what you learn from your clinical postings and practices. And it's very easy, symptoms, they don't follow the script. I always tell my patients, I am nothing but I am just an engineer who's going to repair your damaged part. But the difference between a person sitting outside and doing this job and me is I'm going to do this with the machinery running. So you're not going to stop the whole machine and repair a part and let it go. It's not as easy as it sounds, and it is not as easy as we read in the textbooks. Second thing is that you need to have a team. Never try to run solo. Gone are the days of Shah Rukh Khan, Salman Khan, where Madhuri Dixit. Gone are the days of Shah Rukh and Salman, where it has to be a single star movie. As Shah Rukh Khan said, he's the last of the stars. He is. Now there's a time where we have to club together. We have to come together as a team, as a unit. The medicine is advancing every passing day, and your team doesn't mean your team of doctors. It means your team of nurses, your team of counselors, your team of doctors yourself, because you are not treating a disease, you are treating a patient. And the last point is that you have to be emotionally resilient. Even with all the dedication, with all the prompt diagnosis, with all the best possible treatment, you might not be able to save the patient due to XYZ reasons. But it is okay. Go up, get up, and next day, new beginnings. So I think all of us will agree with me on this. We treat maybe 30 patients, 50 patients in a day, but we always go back home with that 1 or 2 patients whose diagnosis is still not clear. We never go back home with those 38 completely treated and well diagnosed patients. So it's all about learning, keep learning. It's a very fun field. You have to be passionate about it. The numbers are increasing, take it from me. The way, all thanks to Modi, but the way he has engineered the doctors are going to be the next engineers. So be passionate about what you do, and I think sky is the limit. Thank you.
Very nice discussion and some very useful experiences shared by our panelists. Students, any one of you who would like to ask any more questions? I'm sure आपके मन में होगा, जैसे सर मैं बताऊं हेमंत सर, आप हमारे पैनलिस्ट ग्रुप में थे तो हमारे मॉडरेटर्स जो बच्चे हैं जो प्रिपेयर कर रहे थे क्वेश्चंस कहते हैं मैडम हेमंत सर से थोड़ा डर लगता है, वो हर यूजीसीआर में बहुत क्वेश्चंस पूछते हैं. So anybody, आज आपका टर्न है, आप पूछ सकते हो सर से क्वेश्चंस.
ये मेरे बगल में जो बैठे हुए हैं ना प्रोफेसर ऑफ मेडिसिन यूनिट हेड, ये मेरे को पुछ करके बोल रही है सर आपसे बहुत डर लगता है. What have I done to deserve that?
I can ask a question. Yes. I have a question. The question is straight away directed to both Hemant sir and Ashish sir. 2 days back I was having, these days me and dad we sit quite often. After my marriage I realized the importance of my father. Before that I used to love only my mom. But now I realized how difficult it is. So dad and I were sitting and I told him that there is something which is called as work-life balance. And he straight away told to me that that exists with people whose fathers were very hardworking. But I still think that in today's world, as Ashish sir was promptly saying, you should have a lateral interest or a hobby. But how to maintain this work-life balance?
मुझे ऐसा लगता है I have a very good work-life balance. So I always tell everyone.
See, I was right. Rather
Number 1, always prioritize your health. Always. अभी तुमको नहीं लगेगा you are in your 20s, you will not understand the pressure of, you know, getting into unhealthy eating habits, unhealthy work-life balance, सारा दिन काम करोगे, no exercise. So your exercise part starts from now. He's an exercise freak by the way, मुझे work-life balance बोलता है, but he's and every one of us. So number one is make sure that you exercise. Walk कर लो, yoga कर लो, go out for small walks with your friends. That 15-20 minutes जो हम पढ़ाई में से save करते हैं with your friends, you go out. That de-stresses you to a level where you will not understand that value now. Talking to your friends, everybody here is so much stressed. और आजकल के ज़माने में ज़्यादा डिप्रेशन होता है. Make sure that you make good quality friends. Number one. Number two, develop a hobby. I think Mahatma Gandhi में Dr. Pratibha Vyas, and she is so much into developing some kind of hobbies, instilling hobbies into all of you. Be it photography. My 13-year-old daughter is into photography now. Professionally, she's doing her photography, and all thanks to my husband. He is a GI surgeon, but he is pursuing this wildlife photography. So all our holidays are now in jungles only. So we don't go to Paris, London, anywhere. We go to Manas National Park, Arunachal Pradesh, everywhere where there is a national park, we are there. So you get connected to the nature as well, right? So make sure that you have a hobby and take out time for exercise. Work-life balance फिर अपने आप हो जाएगी. जब exercise करने लगते हैं तो लोगों को लगता है कि हाँ इसके बिना हमारा दिन नहीं चलता है. And listen to good songs. I am not into music, but I have now realized, I think if somebody is a music lover would understand that if you have a good collection of songs, whenever you are stressed, आपको लग रहा है मुझे किसी पे गुस्सा आ रहा है, मुझे किसी को डांटना है, मैं depressed हूँ, please listen to a good song. I think that changes your mood. And those 10 minutes which you give to yourself, जब आपको बहुत तेज गुस्सा या frustration या depression हो रहा हो, so those 10 minutes if you give to yourself, listening to a good song or maybe a stand-up comedian, that would change the mood. जो आप 10 मिनट पहले थे, 10 मिनट बाद अगर आपको 100 out of 100 गुस्सा तो maybe it will come down to 50%. That's what I think.
As per the NMC and the today's panel discussion, what we had designed was that we have tried to highlight the 5 roles that a physician or a doctor has to play in his professional career, starting from the clinician to an effective communicator to a leader of the healthcare team and to a professional, of course, and a lifelong learner. Now, I would just open this question. Any of the panelists can answer, sir, that recently, as per the new guidelines, 2 new roles have been identified. That is a critical thinker and a researcher. So, if anybody can just comment and or share your experiences. Researcher is, of course, something so I think वैसे तो Hemant sir is the most appropriate, but still, any one of you.
No, I'm not going to talk about research. I'm going to talk about critical out-of-the-box thinking. आप लोग सब लोग जितने भी यहाँ पे हैं सब लोग हाथ खड़ो जितना ऊंचा खड़ा कर सकते हो करो हाथ ऊपर. So देखो, this is what I want to convey to you. I said जितना भी ऊपर खड़ा कर सकते हो उतना खड़ा करो, right? So why did you not stand and do this? Why did you not climb on the table and do this? So अपने हिंदुस्तान में क्या है कि right from the school जो original thinking है ना, that is crushed and suppressed. Your teachers, your school, your principal just want you to think in that structured fashion. It is like वो घोड़े के जो blinkers लगे होते हैं ना, और सीधा के अलावा कुछ दिखना नहीं चाहिए. So आप लोगों में से 200 people में से जो एक जना जो world leader बनेगा, वो बनेगा जो ये blinkers हटा करके out of the box सोचेगा. Things are changing now in school. Original thinking is being encouraged, but at least when I was in school, and possibly when you were in school, innovative thinking, original thinking, out-of-the-box thinking was discouraged. So, if you have that streak in you, please encourage that streak. If I see that streak in you and you interact with me anytime, I will 100% encourage that streak. There are very, very rare students now in whom I see that streak. So somebody else can talk about research.
So I would like to answer about the research, and the research starts with critical thinking. Yes, sir, ends. सब कुछ लिखा है किताब में, फिर भी every year there is something new added, something new is coming. How and who are the people who are thinking like that? सब कुछ दिया है ना कि ये ड्रग होती है इस प्रॉब्लम के साथ में ये काम करता है. Then why there is need to develop more? Because you need to find out some problem, some more good things. You need to learn, you need to think, यार मैं इस प्रॉब्लम को कैसे सॉर्ट आउट कर सकता हूँ. Some new machine, some new gadget, some new type of implants. Then only with this critical thinking you go into research. And research now is an integral part of AIMG. Once you have done with your MBBS, you have to start your research. Please read and start reading new guidelines, new articles, so that you can learn newer things. From where you can pick few of the things and then start taking those particular spark for the future lights. That is the research.
On the lighter note, critical new thinking, ma'am. Critical thinking. बच्चे कितने आजकल शैतान हो गए. So I was taking this final MBBS class, or maybe उनसे शायद एक छोटा होगा. And I was teaching here. वो पीछे के दरवाजे से क्रॉल कर करके अंदर आए. Never ever in my life I have seen students like that. तो मुझे लग रहा है कि ऐसे I thought students have become so smart now that this is the critical thinking that they are developing. वो दरवाजे से क्रॉल करके उधर अंदर आ जाते हैं.
So I think with this we can conclude the panel discussion. Can we have a huge round of applause for all our